Hello, I am Dr. Ali Al-Sultani, consultant cardiologist in Ibn Nafis Teaching Hospital, Baghdad, Iraq. I would like to thank you to give me an opportunity to talk about the acute coronary syndrome risk factors in the Middle East. You know, acute coronary syndrome is a broad spectrum diseases that include unstable angina and acute myocardial infarction in its two forms, ST elevation and non-ST elevation myocardial infarction. And it is usually due to a rupture of an atherosclerotic plaque complicated by thrombosis. The most important risk factors leading to the acute coronary syndrome are the following: the modifiable one and non-modifiable ones. The modifiable risk factors are tobacco smoking, dyslipidemia, hypertension, obesity, sedentary lives, diabetes, and harmful use of alcohol and poor dieting. The non-modifiable risk factors are actually the family history, age, and the gender. We have to look also for non-traditional factors that are actually important in supporting the information of traditional risk factors. These non-traditional risk factors actually associated with an increased risk of cardiovascular disease, but the United States Preventive Service Task Force suggests that current evidence is insufficient to assess the balance of benefit and harm of using non-traditional risk factors studies to screen asymptomatic men and women with no history of chronic heart disease to prevent coronary heart disease events. These are high sensitivity C-reactive proteins, ankle brachial index, leukocyte count, fasting blood glucose level, lipoprotein A level, periodontal disease, carotid intima-medial thickness, coronary artery calcification score, and homocysteine levels. What is cardiovascular prevention? It is a coordinated set of actions, and it aims to eradicate and eliminate or minimizing the impact of cardiovascular disease and their related mortality, and should be done at the individual and population level. Why is cardiovascular prevention needed? Because the atherosclerosis process that leads to a premature death in people, and it also affects both men and women. Of all deaths before age of 75 years in Europe, 42% are due to cardiovascular disease in women and 38% in men. Most patients are followed up in primary care, and screening the population for cardiovascular risk factors is preferably done there. The recommendation regarding the risk estimation, it is recommended that the total risk estimation using multiple risk factors, such as a score, is recommended for asymptomatic adults without evidence of cardiovascular disease and is a high grade, class 1 level C. The high-risk individuals can be detected on the basis of established cardiovascular disease, diabetes, moderate to severe renal disease, very high levels of individual risk factors, or a high score risk, and are a high priority for intensive advice about all risk factors. You know that the information that we get about the risk factors in the Middle East actually are scarce, and all the information that we get are derived from the European countries. But this registry, which is a Gulf registry or Gulf race registry, which was done at 2007, and it lasts about 5 months period. It studies the prevalence and impact of cardiovascular risk factors in patients presenting with acute coronary syndrome in 6 adjacent Middle Eastern countries participating in the Gulf Registry of acute coronary events. They recruits about 7,000 consecutive patients with acute coronary syndrome. They found that 61% had non-ST elevation acute coronary syndrome, and 39% had ST elevation myocardial infarction. This table shows the prevalence of cardiovascular risk factors across the acute coronary syndrome spectrum. They found that diabetes, hypertension, dyslipidemia, and prior use of prior coronary artery disease and obesity were the most prevalent cardiovascular disease in the Gulf area, and also especially in non-ST elevation myocardial infarction. But in comparison with the STEMI people, they are more likely to be younger, actually, and they are not using aspirin before. This slide shows the prevalence of cardiovascular factors in the 6 participating countries. We can see that still diabetes, hypertension, dyslipidemia, smoking, and obesity are the most prevalent risk factors in the Middle East countries, especially in the Gulf countries. However, in Yemen, you can see that the smoking is the most prevalent risk factor. And also, we can see that the heart failure and mortalities are more prevalent in Bahrainis and in Kuwaitis. And also, you can see that the obesity is more prevalent in Bahrainis and in Kuwaitis, while the heart failure is more prevalent in Omanis and in Yemenis, while the mortality is more actually in people in Yemenis and in United States Arab Emirates. This slide demonstrates the cardiovascular risk factors in women and men across different age groups in acute coronary syndrome patients. You can see that in women before age 40, diabetes, hypertension, obesity, and prior coronary artery disease were more common in women than men, while smoking is more common in male than in women. In addition to these risk factors, they found that in older age group, dyslipidemia was remarkable or the most prevalent cardiovascular risk factor when the patient gets older. And also it's found that the women are more liable for dyslipidemia than men. And also we can see that there is no difference in heart failure and mortality among the young age group in women, between women and men, while the heart failure and mortality is more actually in older age group. In this study, no mortality difference was noted between obese and non-obese patients. However, when obesity was added to smoking, it was associated with a significantly greater mortality rate in ST elevation myocardial infarction patients compared with obese non-smoking patients. In conclusion, assessment of the prevalence of the traditional cardiovascular risk factor in the acute coronary presentation is cost-effective and of important prognostic value for in-hospital morbidity and mortality. Cardiovascular risk factor and its impact may differ according to acute coronary syndrome type, age, and sex. Most of the important risk factors of coronary artery disease are modifiable and can be treated, and therefore its early identification is vital to set the strategy for prevention. Lastly, not only the traditional cardiovascular risk factor that should be looked for, but also other clinical risk factors should be included in the risk stratification in patients with acute coronary syndrome. Thank you. You know that these coronary artery risk factors are traditional risk factors, are universal cardiovascular risk factors. And the hypertension, diabetes, obesity, and alcohol, and smoking, and obesity were actually the most frequent cardiovascular risk factors in my country and in the Middle East. But probably the obesity now is increasing in our country, especially in women, because of the lack of exercise, and because our mothers and grandmothers, when they become older, they sit in their homes, and they exercise less, and they eat more. So the obesity will be more. And you know, as the age become more and more, all risk factors will be implicated in the pathogenesis of atherosclerosis per se. Especially those people are more liable for hypertension, dyslipidemia, and lack of exercise and obesity. This is one. Secondly, smoking is still a big burden in our country, and it is more prevalent, fortunately, in male rather than female. Our female are smoking less than in European countries. So the smoking habits it is not important as risk factors in our countries and in Middle East particularly. Chronic renal failure, now it is regarded as an additive risk factor, or it is a variable risk factors. Chronic renal failure per se, it is a syndrome, and it's caused by many diseases. And these diseases actually are more prevalent in combination in those people, such as diabetes, hypertension, obesity, dyslipidemia. All these can lead to chronic renal failure. And definitely those people with chronic renal failure at an increase in about 5-fold to develop acute coronary syndrome and insult. So that the early identification of the diseases that leads to chronic renal failure are essential to treat in order to prevent the chronic renal failure per se and its impact on the future cardiovascular system.